How do you test for or find the pain though? This great question was left on a video where we were talking about the high comorbidity between behavior concerns and pain or underlying health issues. And we were talking about how often the first signs of pain are behavioral changes. Specifically, we were talking about how increased or new noise sensitivity is a big red flag for pain. But this can also be an appearance or escalation of aggressive behavior or reactive behavior. It can also be a new aversion to handling or a worsening of separation anxiety. And so anytime we see that new behavior or we see an escalation of that behavior, we need to be going to the vet. But this can be tricky, particularly for folks maybe who either they've gotten the dog as the puppy and the puppy has been displaying these behaviors from puppyhood, which is abnormal, but certainly happens. And often involves pain, or it's an adult dog or an adolescent dog that has been adopted and we don't really know what their norm was before. Maybe they are currently in pain and currently showing those behaviors, and so we don't have the opportunity to see that change. So anyway, in any behavior case, our first step is a vet check for sure. There are sort of two routes that I see taken, and I'd be happy for the vets of TikTok to weigh in on this. But the first route is that we might start with diagnostics. My job, of course, as a behavior consultant is never to recommend specific diagnostics. So the veterinarian is looking at your dog, the information that you're giving them about the behavioral change, and this can include subtle stuff. I want to jump back real quick to what that behavioral change might look like. So it certainly could be things that are a behavior concern, like increased aggression or noise sensitivity. But it can also be things. One of my big clues with one of my kiddos is that when we're out and about hiking, he gets hyper focused on my treat pouch over engaging with the environment. And that's always a big red flag for me that we need to change his pain management. It can be that they're seeking out more affection. They may not necessarily be behavior concerns, but they might just be changes in behavior. So note those things. Changes in sleep and appetite are big ones to pay attention to. So anyway, based on the information that you're sharing and your dog's medical history, their size, their breed, all of their age, all of these different factors, your vet might say, you know what, I have a fairly good guess of where to start. Let's do some diagnostics. And so they might order some diagnostics, and then we're trying to get more information that way. The other route that I see is that we start by treating the symptoms or trying to treat what we think the symptoms might be. And so we might say, let's start a pain medication, and the vet picks a pain medication based on a number of factors. And then they say, let's trial this pain medication and see if that changes your pet's behavior. And if so, then we'll work in the other direction and go to try to figure out why. And that's an important piece. Sometimes I do see that we start the pain medication or, whatever it might be, and we see the behavioral change, and then we don't necessarily loop back to figure out why that caused behavioral change. It's important, I think, to get an actual diagnosis. What is going on? I believe it was through Canine Arthritis Management, which is a great resource if you're not familiar with them. I believe that I saw a post from them recently talking about, I don't have the citation handy, but talking about how 1 in 3 dogs over the age of 1 has the start of osteoarthritis, and 2 out of 3 dogs over the age of 6. When we're talking about aggression specifically, and that comorbidity with behavior or with pain and underlying health issues, Mills 2020, which was a meta-analysis of all the studies related to that before then, suggests that statistically speaking, the number one cause is orthopedic pain, or the number one pain factor is orthopedic pain, and the second most likely is gastrointestinal. I'm also just going to toss my hat in for allergies. So it certainly can end up being sort of a journey as you do some trial and error and figure out different things. But Mills 2020 says that up to 80% of cases involving aggressive behavior involve that underlying pain, either directly or indirectly. Directly is going to speak to, like, my dog has an ear infection and, I touch their ear and they go to bite. Indirectly, the other 3 ways that pain can influence behavior indirectly revolve around things like, the dog's stress tolerance being lowered because of the pain and things like that. If your dog has behavior concerns, working with a vet who also prioritizes behavior as information can be really helpful along that journey.